changed. What has changed are people's lifestyles. What has changed is people's behaviors. I believe that people are eating more calories and exercising less, which is leading to obesity. I think we need to be focusing on educating people about moderation and the importance of physical activity. I believe we should be looking for real solutions and not blaming and pointing fingers to others for our choices. I have seen first-hand benefits in the community changes. In the city of Whittier, an old railroad track was converted to a trailway. Since its opening last year, there have been many families who have enjoyed the trail. I and my family enjoy our evening walks with the dogs. Many positives have come from our walks. We meet new neighbors, talk about our days, and get in some exercise. I believe it is our individual responsibility to take care of our own health and the health of our families. For this, I thank you for your time.
Thank you.
Good afternoon, Senator Flores, committee. My name is Dr. Richard Quesada. I'm the president of Terra's Metabiotics. I'm a former and retired nursing home administrator as a licensed residential care facility administrator. And I've seen over the years the impact of sugared beverages, such as displayed here on my right. And it is very much apparent in this hearing that there is a great conflict between the interests of the companies that are monetarily benefiting from the sale of these products, but it also shows that there's a
spending a lot of money on moderated foods because they can't control what they're doing, so they're spending all this money to do it. Why not just do it yourself? Parents need to say no. Taxing this is not going to help anything. That's all I got to say. Thank you very much.
Thank you.
Afternoon, Senator. My name is Matthew Dotson. I'm Director of Local Government Relations for the California Grocers Association. And I wanted to just make a brief comment about Senator Padilla's closing remarks. And he noted his dissatisfaction with the level of cooperation and ideas from the industry on moving forward in ways that we can work together to have a healthy environment for our children and for adults. And I just want to let you know that our trade association, while we weren't part of the formal discussions here today, we look forward to working with you and Senator Padilla and the Health Committee as well in finding ways that we can talk about this situation and come up with solutions that make the situation better. In moving forward and looking at possible ways to deal with this, there are just a couple general concerns that I wanted to put out there. And the first is we do believe in having as much choice as possible for our consumers. So that means having soda, that means having water that is affordable, that means having any other products from organic produce available for their consumers. And I want to point out, just a couple minutes ago, there was another speaker from Community Health Councils. She was talking about the current situation in South LA, and they're working to try to get more grocery stores into these underserved communities so that consumers there have more choice. And we've been working with them. And one of the leading results that we're finding in that study is that one of the leading reasons why there are not more grocery stores in some communities is the amount of bureaucratic interference. So we hope to work with you in the coming months on this issue. Thanks.
Good afternoon. Thank you, Senator, for your due diligence on this issue. My name is Manal Balata, and I'm Program Director at Prevention Institute, and I provide staff for the Strategic Alliance for Healthy Food and Activity Environments, a statewide network. We've heard a lot of talk today about the explosion of different options and products that are available from beverage companies, and I think, as Ms. Isla Hooker said so succinctly, that these options are not real choices when the pricing, the marketing, and the availability and access is all skewed towards the unhealthy option. And so we are looking to you in your role to really leverage your policy-making power to really make the healthy choice the easy choice by restructuring the pricing, the availability, and the advertising in favor of healthy choices. As a mother of 2 children living in South LA, I know that healthy options are challenging to get for people because there are so many fast food restaurants, hardly any grocery stores, and lots of small convenience stores that could be offering healthier, more affordable options. One healthy beverage, just so the soda industry doesn't feel singled out today, that hasn't been mentioned, or sweetened beverage rather, is formula. Recently, we've seen an upsurge in sweeteners added to infant formula, and that's another sweetened beverage that we have to address in order to make sure that young people aren't starting off from birth addicted to unhealthy beverages. We'd also like to see you use your power to include a healthy beverage environment in all government facilities, not just schools, but also in workplaces and all city-owned and state-owned facilities. And finally, we do support the notion of restricting marketing to children at under 8 years old. And finally, ask you that if you do explore financing strategies, that you do really look very seriously at ensuring that the resources go back into the communities that need it most, that have been identified today, low-income, people of color. Thank you so much.
Thank you so much.
Good afternoon. My name is Stephen Phillips. I'm a district manager with the Coca-Cola Bottling Company of Southern California out of the Sylmar branch. I'm not just here as a Coca-Cola employee, but as a father of 5, aging 1 through 10, and also a youth sport, football, soccer, and baseball coach. You know firsthand the importance of moderation and physical activity for the keys of raising healthy kids. My kids, your kids, and other kids can tell you they love junk food and soda food. However, they can also tell you that these things are treats, and not meals, but rather they can be small parts of a balanced diet. I wish I could say that the children that I've coached think the same way. Unfortunately, each generation of kids that I coach, I see less and less that have been taught or underappreciated of these values. Often, they are more or less pushed onto the fields and also physical activities. They'd rather be watching television and playing video games as well. As a Coca-Cola employee, I can tell you we're extremely involved with the community on promoting health and healthy lifestyles. As myself, as a parent, I'm also very aware and very promotable amongst my children in a healthy lifestyle. And as a coach, my goal is to teach these kids to be active in sports and other physical activities and make it a fun situation. What I can say is that I agree with the notion of singling out a product that people have enjoyed for over 100 years as the determining factor in the obesity epidemic. This is where I think we come in as parents, grandparents, coaches, teachers, community members, where we need to find ways to educate, empower adults and kids to take charge of their health. We need to work together to find real solutions to their very complex problems. Thank you.
Thank you. Go ahead. Go ahead.
Hello, my name is Mindy Schwartz, and I have worked in the...
A little louder and pull your mic.
Hi, my name is Mindy
Pull your
Schwartz.
mic down a little bit. Thank you.
Sure.
There you go.
Hi, my name is Mindy Schwartz, and I have worked in the food industry for over 25 years. My background is and education is both in nutrition and as a food technologist, as well as in marketing, strategy, and insights. I wanted to raise a few factors